Welcome to Bama Dermatology. In today's video, I'd like to talk about the secondary skin lesions and its terminology in dermatology. So how to describe skin lesions has already been talked in my previous videos. So here, I would like to talk about the secondary skin lesion, which is an eruption that appears after the primary skin lesion. These are the examples of secondary skin lesion, which will be explained in the following slides. Okay, first, let's see atrophy. So atrophy is a diminution in size of a cell, tissue, or organ, or part of the body, and it can be divided into epidermal, dermal, and subcutaneous or panniculus atrophy. So in epidermal atrophy, here is the example of epidermal atrophy seen in the aging skin. And in dermal atrophy, depression of the skin is seen in the striate distancy. Here is the striate distancy in this photo. And in subcutaneous atrophy or lipoatrophy, the skin shows more substantial depression. And in this photo, the lipoatrophy show the prominent depression of the skin can be seen. Normally, our skin has normal desquamation process, which is a detachment of the striatum corneum formed from the skin surface, which cannot be seen with our naked eyes in normal condition. So how about the scales? Scales are the accumulation of the striatum corneum due to the abnormal thickening of the skin surface, sometimes resulting in very thick lamellatous scales such as psoriasis. And in psoriasis, so scales are seen from the simultaneous exfoliation of the multiple layers. And there are different types of scales. For example, fine scales in pityriasis, and thick silvery scales or micaceous scales in psoriasis, and fish-like scales in lamellar ichthyosis, which is a congenital disease. And there are two mechanisms of scales formation, which are the retention hyperkeratosis and the proliferation hyperkeratosis. So in retention hyperkeratosis, the layers in the striatum corneum is too thick to be desquamated, and so seen as a large scales after abnormal accumulation like this. But in the proliferation hyperkeratosis, the thickened lamellated scales are seen because the epidermis exfoliates due to overproduction of the keratinocytes. So what is crust? Crust is the solidified keratins and exudates, and they form on the ulcerated or eroded skins. And the scab is a crust that consists of the dry blood. And the callus is a localized hyperkeratotic lesion, which is a thickened striatum corneum, especially on the foot here. And the clavus or cone. In clavus or cone, the striatum corneum began watchage into the skin by prolonged physical stimulation, for example, wearing shoes for a long time. And here in this photo, you can see the cones on the foot. Scar is the reactive process after the dermal damage, resulting in proliferation of the dermal fibroblasts and the production of the collagen fibers. And these are the scar that is commonly seen in the dermatological practice. First is the hypertrophic scar, which is a thickened scar confined to the margin of the wound, and the key-like scar is which extend beyond the wound site, and it tends to spread to the surrounding normal skin. For excoriation, it is a partial damage to the epidermis by injury or scratching, and it heals without scarring, and the tissue damage is superficial. This is an example photo of the scabies. You can see multiple excoriations and the papules on the trunk and the limbs. And erosion is a the epidermal excoriation that extends down to the basal layer and heal without scarring, and often develops after the rupture of a blister or pustule, and commonly found on the sides of the mucous membrane. And they can occur in the diseases that causes intraepidermal blistering. For examples, like pemphigus and toxic epidermal necrolysis in this photo. You can see large erosion on this photo. Okay, ulcer is a complete loss of epidermis or pseudodermis that extend down to the subcutaneous fat. And here in this photo, you can see the large ulcer, and the fissure is the thin linear cleavage that runs through the deep epidermal layer and the dermis, and which is the excess tension and decreased elasticity, and is seen in the chronic eczema of the hands and feet, psoriasis, and the angulitis. So enanthema is the lesion of the mucous membrane, such as oral, conjunctiva, and external genitalia. And after is a painful, sharply circumscribed round erosion of a mucous membrane, which can be 1 centimeter or less in diameter, and it can heal without scarring, and is seen in the viral infections and the Behçet's disease and physical irritation such as poor fitting dentures. Here you can see the aphthous ulcer on the buccal mucosa. So another type of enanthema is leukoplakia, which is a white patch of the abnormal keratinization of the mucosal epithelium, which can be benign or precancerous lesion. Thank you for your attention. If you like this video, please hit the like button and subscribe to the Dermatology YouTube channel and Facebook page. Thank you.